and then leave time for questions as a whole group. You can, I'm sure the presenters don't mind you asking questions during their presentation, but we will leave 15 minutes or so at the end so that they can answer questions all together as a group. Good, does anybody have any questions to start? No? Easy group. The second day is always easier. Everybody's just like, yep, just give me the information. Okay, so I'm going to introduce, actually we thought it would be good, I was talking to Joelle, and we thought it might be interesting because we're at a small group, just to take a few minutes to go around the room to see who's here and where you're coming from, so that the presenters may be able to spend a little more time on some areas and not on others, depending on the needs of the group. So maybe we'll just start with the presenters and then.
I'm Carolyn Doris from the Peterborough County City Health Unit, and I'm a public health nutritionist working in sort of new to the food security area.
I'm Joelle Felpo, and I work at the YWCA in Peterborough, and I do primarily community development work that focuses on food security and social inclusion.
I'm Heather Toma, and I'm from Manitoulin Health Center. I'm working with food programs there, community food programs, and I'm also an organic farmer on Angelyn, working with larger food system questions and projects.
I'm Heather Noble-Volpe, and I work at the Regional Appeal Health Unit, community development work, and not currently doing anything with food, but here because I'm interested in that.
Great, perfect.
I'm Joan. I work for Waukesha First Nation Health Clinic. I'm the community gardener, beginning a community kitchen, bringing in mental health therapy through the garden, and obesity and diabetes childhood prevention.
Yeah, perfect.
I'm Celeste Auger-Prou with the West Nipissing Community Health Center. We are in the process of setting up a day away center for seniors, and we're looking at some community cooking. And we're also in the process of setting up a good food box program. So interested in
yeah.
Kelly.
We're just doing introductions. No pressure. You walk in, you're like,
Yeah, I'm Kelly Henderson. I'm the health promoter at the Chickaman Community Health Center up in Midland.
Good.
We serve Aboriginal, Francophone, and Anglophone communities. We've got a community garden.
Awesome.
That's kind of the end of the plan.
Okay. Hopefully after today we'll
That was the planning document. So
Yeah.
I'm like, okay.
Okay.
I think maybe we need to kind of figure out what we want to do with this community garden.
Yeah, good.
We're in collaboration with the Midland Community Garden, so it's sort of another body that runs it. So I want to figure out how we can do the partnering and stuff.
Awesome.
Yeah.
Perfect. Let's go to the back room.
I'm Sunday Harrison. I work in a nonprofit in Toronto doing school gardens. I'm also affiliated with the Ontario Edible Education Network, which is working to build out a bunch of policy platforms around healthy eating and from the healthy farming through the food system. And my work is specifically with schools.
Good.
My name is Janelle Vandergriff. I'm a community developer at Somerset West Community Health Center in Ottawa. I do quite a bit of work around food security as it's been identified in the neighborhoods I work in. So lots of food deserts and trying to do things like good food boxes and good food for kids to address that.
Awesome.
My name is Mike Turnbull. I'm with the Unemployed Health Center in Windsor. We have a number of initiatives. The latest one is a Plentiful Harvest. It's a food rescue initiative. We are the hub of the 18 food banks in East Essex County. We have a community kitchen and local or community garden, which is more company just give us a whole bunch of land so we can expand on that community garden. So lots of stuff around food security, especially in the area that we live in. It's so hard hit, right? So yeah, we're trying to take a bite out of it.
That's perfect.
Nice.
My name is Anita, and I'm a program manager at Evergreen, based here in Toronto, but we have a grant program that supports food growing initiatives across the country. So anything that addresses food security issues, especially with youth or vulnerable communities and First Nations and Aboriginal communities. So I'm here to just learn more about what's going on in Ontario.
Wonderful.
That's okay, I'll come back.
Okay, all right. I'm Joyce Riley.
I'll let him sit down for it.
I'm a health promoter with a community lens at Peel Regional Health Department. And just getting into a bit of the food security because our team is starting to look at what we need to do in that area. And so looking at what's out there as far as the research goes and all that, that won't be mine, but I'll be doing other parts of it. So I just want to come up to speed on that. But I've done work in nonprofit housing over the years and a bunch of other stuff. So
Wonderful. Wonderful. Lisa?
I'm Lisa Galan. I'm the coordinator for Healthy Living Niagara, which
director of the Dunnville Hospital and Healthcare Foundation, and I'm the board chair of the coordinating committee for health communities of Northfolk. So I'm here in a volunteer capacity and just trying to glean all kinds of information.
Perfect.
I'm Ellen Lukusiak, I'm a dietitian at Ottawa Public Health.
Oh, wow, okay.
And I'm just here because I'm just always interested.
A dietitian.
I'm Christina Souza. I'm with the Ontario Public Health Association, and I'm involved with the Community Food Advisor Program, and I also came here to learn and hear more about your programs.
Excellent. Techie?
I'm Robin Hall. I'm HC Link staff. I'm based at Health Nexus, and I'm live streaming today. So I've got my back to her, but I'm actually looking at her on my screen.
So she is paying attention. Monsieur? Name, where you're coming from, your perspective.
It's
for interest in
French or?
Oh, whatever you want. Everybody so far has done it in English, but.
Ok, je m'appelle Jean, je suis agent au RUSO, qui est un regroupement des intervenants francophones en santé et en services sociaux.
Oh. Okay. I snuck in another one. I missed one. Please.
My name is Angelyn. I work with the School Mental Health Assist Program, or the initiative, and it's really to support schools around building their capacity around supporting kids with mental health issues. So not at all related to nutrition, but there is definitely like that sort of really important connections to make with mental health.
Yeah, that's excellent.
Yeah, and from a personal perspective, I think it's extremely important. Food security is going to be the big basis, right, for our communities. So
Absolutely. C'est tout le monde? Okay. So ladies, so I want to welcome Carolyn and Shalelle, who just introduced themselves. So we'll let them go for approximately 20-25 minutes, and then Heather, and then we'll have a great discussion, I'm sure.
Great. And I think this is our music.
I believe so, yes. Robin?
So maybe?
I hope that works.
That's a blinding blue.
I was just sitting along,
Yeah.
that's fine.
Oh, and we've gone to sleep.
Did it go back to sleep? Let's push the power button. It seems to really go.
Oh.
I'm off of that.
Okay. No, I can stand, that's fine. So Joelle and I are going to speak today about sort of our recipe, which has been not an overnight recipe. It's taken a lot of shopping around of our community to pull the ingredients together. But we think we have the start of a really good base of what we want to cook up in our community around food security and community development and making an impact on our food system.
The other one.
No, not the other one.
I wanted to get them both up.
Okay.
So.
And perfect.
Okay.
There we go. And we've had a long, I would say our organizations, the YWCA of Peterborough, Victoria, and Haliburton, and the Peterborough County City Health Unit, we've been really fortunate to have had a long relationship of working together, which has certainly been, I would like to think, mutually beneficial. And since Joelle is still supporting and working together, I think that speaks to a piece. And certainly with public health, because we're tied to public health standards, there's only so much we can do, and with budgets, and that's where it's been amazing to have community partners that have a little more leeway and tap into different funding, and at the end of the day, though, we're all working together for the same piece. So in Peterborough, this is the definition we use for food security, that all people at all times have physical and economic access to nutritious, safe, personally and culturally appropriate foods. And we've also added in, which is that sort of the typical definition. But locally, we've also added through our community food network these other two components, that we're looking at food that's produced in a environmentally sound, socially just way, and that we're promoting community self-reliance, which is certainly easier to say than do, but is something that at least as a goal we have. And I think the critical piece for us is that when we look about food and our food programs, and we do have a lot of food programs in our community, that we're looking at things that really promote human dignity at the end of the day, and that we try to weave that in through all of our programming, and breaking down barriers and making programs accessible, and that we're just being respectful. So certainly from the public health standpoint, and certainly I think from a lot of the community health, many of you, the whole idea around food insecurity and the social determinants of health. And that's really where we really see food security as really just the mere tip of the iceberg in the work that we're doing. And that in fact, it's the social and economic challenges, it's affordable housing, it's that all those things that lead together are bringing our vulnerable communities, those most at risk. And that certainly it's complex, the solutions aren't easy, and there's many different types of policy decisions and programming opportunities that we can work together to look at the bottom part of the iceberg so that we at the end impact food insecurity and start to make a difference around going back to our community where food is available for all and there's dignity at the end of the day. So, as a public health nutritionist, certainly the nutritious food basket, which is a protocol through our public health standards, is certainly one of the key pieces that we see around looking at the supports and what does it mean around food insecurity. And that bottom line for us, that really we know limited incomes are the issue in our community, that when taking into account housing costs and the cost of our nutritious food basket, which we price yearly, that when you look here at a single man on Ontario Works, if he was to buy that nutritious diet according to the nutritious food basket, he would be in the hole $214 every month. So at the end of the day, people don't have the choice to buy nutritious, healthy foods. And when we look at the impacts, then that's where we're really back to our food security, and that if we want people to be healthy, we really need to be looking at policies and supports and mechanisms in our community that can make a difference. And certainly we know, and all of you that have talked about your involvement with food security, it's those pieces that if you can't afford to eat a nutritious diet, you're not eating fruits and vegetables, you're not eating lower fat milk and alternates, you're making those choices. And this is the negative picture that we've got. That's certainly even before we look at other costs like transportation and whatnot that we know are also rising costs in our community as well. So certainly those living on social assistance in our community we know are particularly vulnerable, and that's why we've come together for a long history of working together to try to make a difference. And it is a long road, but we think we are making a difference, and that's why our partnership stands strong and continues to work. So in Peterborough, our medical officer of health, food security has had, or I guess poverty has had quite a bit of work and a lot of public interest, particularly 2 municipal elections ago where we had a candidate for mayor in our city that said, poverty is going to be the issue that I'm going to address if I'm elected. Unfortunately, she was not elected, but does remain very passionate. But the opposing mayoral candidate stole her, well, I shouldn't say stole, adopted her platform. And so at that point then we actually had in the city of Peterborough a mayor's task force on poverty, which then grew out into a Peterborough Poverty Reduction Network that has groups and community partners looking at poverty and its impacts. So there's, Joelle, you might have to help me, there's a housing group, there's a basic needs group, there's an income group, and then the Community Food Network was initiated as a way to bring all the partners around food, food programming, access to food, healthy food, together as a lens and as a group to talk about policies and to look at next steps. We're probably not exactly a food policy council yet, but maybe we're getting a little bit more that direction, but certainly an opportunity to bring together. So as part of the CFN, the Community Food Network, we've adopted our food security continuum and have really tried to focus our meetings and the work in our community to bring the groups together so that we're focusing on the short-term relief, the emergency food, which we call need food. And this is actually the sort of a snapshot of our website, and if you're interested, you can go through the health unit at www.pcchu.ca, and there's a link to Food in Peterborough right there. And when you click, if you were to click on the empty bowl in Need Food, you'd then be able to see a whole listing of the amazing programs that people are running in Peterborough to try to make a difference for those that are needing food today. So not only do we list our food banks, we have a regional, it's called Kawartha Food Share, that is a warehouse for all of our food banks, and they do look after food donations, and member agency food banks then coordinate through that group. But we have a really active faith community that's done a lot, and just a community that's done a lot around community meals. So right now, 3 times a day, every day of the week except Sunday, people in need can come together for a community meal, whether it's breakfast, lunch, or dinner, in different areas throughout our city. Right? And again, that's through that Need Food piece. And in that website section, you'll also see where we've done some mapping with our county and city GIS departments, so that we can actually look at food programs that are about needing food. So whether it's a food box drop-off site, our Just Food Box program, or if it's a school breakfast program for families that want to make sure that there's a breakfast program in their children's school, that they can access food, where community meals are happening, even where our grocery store is. That's all. We've done that by all of our our 8 townships and also the city. And then with the building capacity, the getting involved piece, which we talk about, that's where we're really looking at those capacities to build individual skills around healthy cooking and opportunities for growing food. And again, we've got some strong partnerships there. Certainly as a health unit person, we like to think of we have a long-standing collective kitchen program. We, along with community partners, support a Peterborough Community Garden Network, which is growing like wildfire, or maybe like kale. Joelle is our kale fan in the crowd. But right now, it's upwards of 30 gardens happening.
Yeah, 26 in the city and 7 in the county.
And 7 in the county. Wow. So we've had a lot of interest and support, which has been great. But so in that get involved piece, really looking at those capacity building things that will be making a difference for our community. And then in the system change, that create change piece that we talk about as well, is really where we're looking at the policy piece and next steps. And I think one of the pieces which we'll be focusing on what we're talking about next that we were really excited about. In 2011, the City of Peterborough began their open consultation for their official plan, which was called Planet Peterborough, which was they really tried hard to engage the whole community, the whole city, about the official plan with presentations and consultations and whatnot. So the Community Food Network took that opportunity to develop a Plant It document, which looked at the official plan from a food lens and a food security lens, and made recommendations to the City of Peterborough around how food could be central to the official plan. And I think that has been a real leveraging point for our Community Food Network and the programming that we do, that we're really moving towards that system change piece, and looking at the preservation of farmland, urban agriculture, supporting and looking at food policies that support everyone. And one of those pieces that we were able to get into the official plan in its draft format right now was a downtown food hub center that would bring people together around food security. So that's what we're going to talk about today. But I just wanted to show as well that when the Community Food Network came together, we realized how complicated our system is and how many partners are working in food, and it really is a hot topic. So I know this is a little hard to see, but and this is a little dated, that it was 2011, and our Community Food Network has identified that in 2 years a lot of the players have changed. But when we looked at food programs and interest in a food hub or a community food center and community members working in food, we were able to break down the groups by agriculture and growing food, and the different groups that are involved in that. And we have the benefit in Peterborough of having a rural community that's actually growing food too. looking at education and groups within education that are looking at, again, at food and food policy and food security. Then we have our health organizations, including groups like our health unit, and again, looking at the connectivity and the types of programming that we're supporting that fit into the other pieces. And then community organizations, which is really the biggest part of our wheel there, which again, we're very fortunate that so many people were excited about food in our community, and looking at where we bring these groups back together, how can we knock down maybe some of those segregations and work together as a community food network. And that's where our project Nourish comes into play, which I will hand to Joëlle. Thank you.
Juste avant de commencer, je vais dire que je vais faire la présentation en anglais, mais vous pourrez me poser des questions en français après, si vous voulez. So Carolyn really has given you a bit of an overview, the kind of the context in which this project started. I think it was in late 2008, early 2009. So Carolyn mentioned that we have this community food network. Some members of the network decided to come to Toronto and visit the stop. I don't know if most of you are familiar with the stop. We were already interested in trying to explore how we could push the needle a little bit more around food security in our region. So we were trying to imagine what could we do, how could we engage more people, how could we make more of a difference. So we came here and took a look at what was happening at the stop and came back to Peterborough and thought, yes, we really want some of the ideas that are presented in the stop, but people who are involved in food security work around rural communities will know that most food security initiatives grew out of metropolitan centers. And so when then you go to, I don't know if you know our region much, but it's basically urban and rural regions, half-half. So what do you do then in a region like that? Because while we really like the stop model, we know we are not Toronto. So we started to get together and to talk about what could we do. But we knew we wanted growing, cooking, eating, building communities through food. We knew that that was the key to what we wanted to do. So I'm going to talk to you a little bit about the key ingredients to this project. And right from the start, actually even before we came to visit the stop, we knew we wanted to find a model that could be speaking to both urban and rural components. So that was really important because all the stories that we were gathering around food security spoke about how much people in the rural communities are isolated, and access to food is also really challenging in those areas. And transportation, I mean, every time we talk about an issue in the county, the issue of transportation is key. So, so what could we do to try to find a way to address those pieces? And we spent quite a bit of time exploring that, and I'll tell you later on how we came, what we are thinking of doing. But what we liked really very much about the stop were the 3 pillars that are built into the stop model, and since then into the community food center model. So it's the idea of first you have to make sure you have access to healthy food. Without that, nothing is going to happen. But once you have access to healthy food, what do you do with it? So we knew that food skills were really important to build into the system, both in terms of growing food and in terms of cooking food. So that's the second pillar. But if you've been to a collective kitchen, for instance, you know that so people are cooking together, eating together, and very quickly what ends up happening is that stories about food start to come up. So what we also are building into the system, the third pillar, is out of access to healthy food and food skills, and then we move into advocacy. Advocacy both in terms of anti-poverty and advocacy in terms of food and the food system in general. So those three pillars are at the heart of our model. But we also have been talking about one of our partners called Peterborough Eats, which has a cafe in the public library. And what they are doing is they're building employment skills for people who have barriers to employment. So we also wanted to integrate that into the model. And then there's a lot of discussion in our region around distribution. And so we also want to see how can we build this into our overall model. And finally, we really feel that food builds community. And so how can we find a way to engage the whole community around this particular project? So what has clearly been working for us with this project, but also since Carolyn was talking about it's been a long partnership. We know that if we want this work to work, we have to start with where the community is at. So community development work is the basis of our approach. So we know that, for instance, in terms of the work that we're doing in the city, it may not be the work that works for the county. So for instance, in the spring, we did a series of roundtable conversations throughout the townships and said, okay, so we brought together stakeholders around food and said, what would you like to see happen in your community? So we want the movement to really grow from each community. What was interesting around that series of conversation is that there were lots of different patterns that came up in the conversation. The one piece that was common to all the roundtable conversation was around food skills. That is really the piece that is seeming to engage lots of people right now. Otherwise, one community was talking about doing community gardens that they haven't started to be involved in community gardens, so that was their interest. Another one was trying to create a local farmers market. So we saw different ideas coming up, but food skills was really reiterated throughout those roundtable conversations. So by doing this kind of work from the ground up, we are seeing that we're hearing different champions coming from different areas, and that makes the model much stronger. So that's how we started to establish that particular model, and we feel that it will be much more of a sustainable model in the long term. So I think several years ago we got together to talk about, we were focusing at that time on community gardening and why it has been working. So we did kind of a historical timeline going back to the 80s. And one person in the group said, really, we're not growing plants. I mean, seeds just want to grow, on their own. You just give them a little bit of soil and water. What we are growing are really relationships. And that is what we're seeing throughout the work that we're doing. Not only in community gardens, but in other community food initiatives. By building relationships, we're also creating new connections within communities, and that was very visible as we were doing the roundtable conversation. Interestingly enough, people may have known each other, but they didn't know each other in light of food. So they started to create more connections. Oh, sorry. Yes,
okay.
I know I tend to talk a lot.
You're capping it.
Yes, thank you. I was hoping that there had been a
clog. I know there was an A.
Yeah. So connections are really being developed, and actually, what I want us to do is to find a way to put that as an indicator. If we're seeing a growth in connections and in partnerships, we're starting to see things happening that multiply. So the image here is an image of really our whole area and how we want to build those connections throughout the region. Another key ingredient, we have to be flexible. So again, we have some ideas of a model, we have pillars, and we are building principles. But at the same time, we know that we have to find a way for each community to see what would work for their own context. Well, you know, hard to talk about food initiatives without talking about funders, because without any funding, none of that work can really happen to any extensive way. So we are right now, the YW has received a trillion, Ontario Trillion Foundation grant, and that's how we're doing this work. We have also been supported by healthy communities. Right now we're engaging in doing an evaluation framework for the project, and that has been through healthy communities. And we also received a fund from Carrot Cash, and I'll tell you more about that when I get to it on the slide. So access to healthy food is indeed at the core of our work. And as Carolyn has mentioned, we're really engaging in this work from a food system kind of approach. We also have been supporting particularly people living on low income in having access to healthy food, but we're also seeing this project as a whole community project. We have really wanted to find a way to build relationships with local farmers, and we have lots of local farmers in our region. So we're trying to see how we can build those connections with people who have the least access to food and farmers who are also living often on low income. So how do we do that? Particularly because, as you all know, we see food, or our whole society sees food as a commodity. And as soon as you see food as a commodity, it shifts how, you know, everything is organized. So we're trying to change that particular perception. So community gardens are a vibrant part of our work. And as I was mentioned before, we have lots of gardens that have been growing. Locally in the city, we've had the chance to create a community garden policy, so that has also been an impetus, yeah, I think I can say that, around community gardening. But what we've been doing starting in May is we thought, okay, so we have all those ideas around this model. What can we, you know, are they just ideas or do they make sense? So we started what we called a taste of Nourish in partnership with the church. And through this pilot project, what we've been doing are cooking sessions. So for instance, today there's a cooking session happening in that setting. And an example, I mentioned Carrot Cash being a funder. So Carrot Cash gave us some funding to create market coupons. So in terms of those cooking sessions, for instance, what we have done is that we brought people to the local market, and everyone has a chance to go around the market, see what's in season, and then there's a facilitator who then buys ingredients at the market, and then everyone goes together to the church and cooks together, and then eat together, and every participant gets coupons, $10 worth of coupons to go and shop at the market whenever they want. And we are just in the process of doing the evaluation of this one, and it's really...
That's your timer. I didn't know it was going to be that loud.
So,
go ahead and take.
So I'm just going to say, and then just going to this slide. So what we're really trying to say is that we're embracing our whole region and trying to find a way to connect all the region through those pillars and through those principles, and see then what comes out of that. We don't have yet the whole model defined, but what we're seeing definitely are positive steps in that process. So we are particularly interested in hearing from anyone who's doing some work that was similar to that, to see how we can learn from other people's experiences. So thank you so much. So
perfect. So we're going to have a chance for questions from this great presentation, but I'm going to ask Heather to come up, and we'll hear her wonderful information, and then we can have some time for full discussion. So if you have questions, write them down. So if you're like me, you'll forget by the time we get to questions. And
yeah, that's good.
Good.
Great, thank you.
Perfect.
Excellent. So my name is Heather Tolma, and I'm here on behalf of Nourish Health Center, which is on Manitoulin Island. And we had 3 other people that were potentially going to be here presenting with me. Julie Rochford, who's a dietitian at Nourish. So Nourish works with the 7 First Nations communities across Manitoulin. And then Joseph LeBlanc, who works with the Anishinaabe Nation, which covers 2/3 of the province of Ontario. It's 49 First Nations communities. So he's been offering input to this presentation, but also wasn't able to be here today. And Carmen Pinawanaquat from the Whitefish River First Nation has been part of our Good Food Box program that I'm going to be talking about today. So we've got lots of people with health issues. So I just, in the healthy communities context, we're all doing a lot of really good work in how do we keep ourselves healthy so that we can keep doing that. So I'm very happy to be here. I'm the coordinator of the Good Food Box program on Manitoulin, and also an organic farmer myself. So I've been on Manitoulin Island for 10 years. Came originally as a farmer, running a CSA project, growing organic vegetables, and but also doing education and community development work along the side with that, and realized that the actual hands-on farming was important, but other people were also doing that, and so I've shifted now into doing more of the community development and education work fully. The pendulum sort of went all the way to one end, and now I'm sort of trying to find this happy medium and balance, realizing that actually the hands-on work in gardening is really important too. So how do we put these different pieces together? How do I do that? So this is one of the ways that I've been doing that, is working with, let's see, going with this. There we go. So Northern Rural Good Food Box Program and the Manitoulin Child Poverty Task Force. So we began our, that's all of that. There we go. So as has been said, there's a balance between the urban and the rural issues and contexts in Ontario. And so, okay. Right, so we're here in Toronto, and Manitoulin Island is here. Are people mostly familiar with Manitoulin? And this is considered Northern Ontario, right? That's when people think of Manitoulin, they think that's Northern.
We're not that far away.
And we're not, right? So we work quite closely with Sudbury, which is here, but then we're also part of a Northern Good Food Box network, which you may be interested in, others who have Good Food Box initiatives that they already have or want to have.
I'm more northern.
I know, right? I was going to say, so that the Northern Good Food Box initiative that we're part of, this is my pointer here, so is part of, so Sudbury, North Bay, Timmins, you're near Timmins, right? Okay, so they're near Timmins, Thunder Bay, and then Kenora is up here, and then Joseph LeBlanc with NAN, Anishinaabe Nation, is based out of Thunder Bay, but he's working, NAN covers all of this territory here, and so all the way up to Hudson Bay. And one of the primary programs that they're working with is in Fort Albany, which is here at the mouth of the Albany River, and they have a Good Food Box program that's bringing food from Toronto, from Food Share, by truck, and then by train, and then by plane to Fort Albany. So when we talk about urban issues and then rural, and then remote, right? So there are lots of different contexts to be able to think about, and so I'll bring in a little bit of that perspective from Joseph and Fort Albany and what they're working with, but primarily I'll focus on Manitoulin, since that's primarily what I've been working with. But if people are interested in that Northern Good Food Box network, let me know and we can hook you in. We do teleconferences a few times a year and have an email network. So rural versus remote versus urban, and that there's a lot of, like you were saying, lessons that we can all be learning from each other, even though our contexts are different. Some of the principles are the same. Let me try that. This one. So Manitoulin itself, if people aren't familiar with the scale of it or the size, is 160 kilometers long. So it's about 2 hours to drive from end to end. And so when we say we have a Manitoulin Good Food Box, we have 7 different communities currently that are a part of that. And it's primarily the First Nations communities right now that are working with it. But it's one Good Food Box program, but it's serving 7 different communities that are up to 2 hours apart from each other. So again, the transportation and distances and access is a challenge, but it also allows a lot of collaboration between all those communities. So Navasing First Nation is the furthest west of the communities. The First Nations communities, Melbourne Bay is a little bit further. But in terms of the Good Food Box, Navasing is our furthest west community that's participating, and then Wikwemekong is the furthest east, and everywhere in between. So, we have a lot of collaboration and a lot of driving. So our Good Food Box program came out of the Manitoulin Child Poverty Task Force, and that's a wide range of different, primarily staff people working with agencies and organizations, but also community members who are retired teachers, ministers, parents, other school employees, and really all wanting to focus on this question about children and nutrition and food security, and realizing that focusing on kids was one way that's really been able to draw a lot of people together. And so we have also a very strong partnership in this group between the First Nations and non-First Nations partners. It's something on Manitoulin over time that generally initiatives have been either First Nation or non-First Nation, and this group in particular and these issues, it's been amazing and inspiring. Someone in one of the sessions yesterday said, if people just come back, you're excited, right? You start, you have an idea, and you think, okay, well, some of us think this is a good idea, but if people don't keep coming back, obviously it wasn't. People keep coming back, and it's this collaborative effort between the different cultures that's been really successful around these issues. And so in terms of probably a lot of these statistics people may already be familiar with, but so in terms of poverty, 1 in 10 children in Canada is growing up in poverty, but in terms of Aboriginal children, it's 1 in 4. So the issues are much higher and stronger. And 11% of food bank users in 2012 were Aboriginal, but they only make up 4% of the population. So again, there's a disproportionate use there. And then a disproportionate burden in terms of nutrition-related illnesses with Aboriginal children, and food insecurity in general. For Aboriginal children, ranges, there are various different statistics, but from 21 to 83% food insecurity rate, as compared to 3 to 9% for non-Aboriginal. So and the other thing that's very interesting as I was looking into information, the UN has a HDI, Health Development Index, I think is what that stands for, and Canada ranks 11 of the countries in the world, and the Aboriginal population in Canada ranks 73. So it's, we know those things, but it's a little bit of context. And I was surprised actually that there haven't been more sessions here connecting to First Nations populations, and I haven't been to the conference before, so I'm not sure how it is overall, and I'm sorry that my partners from those communities weren't able to be here, but I'm glad at least there's some conversation and people that are working with how many do you have First Nations communities in their areas? Great. Okay, good. So yeah, that's something that there may be other people that want to share perspectives from their communities on that specifically. And so the Manitoulin Child Poverty Task Force originally came out of a visit by Val Tarasak. I don't know if people are familiar with her work in food security. She's based in Toronto and has done work on effectiveness or not of community food programs, and realizing that we think these are good ideas, but they're not always having the impact that we want them to have. and she's focused on communities in Toronto and an urban center. But one of our amazing champions on Manitoulin invited her to come to Manitoulin, and she was really interested in that because she didn't have experience in rural areas and with First Nations. And so she came and spoke for a day from her perspective, and then we had a huge community dialogue about what was happening locally, and that momentum has been carried into this organization. So if you are interested, she or people that are working with her, there are lots of researchers at U of T Public Health that are doing amazing work. And if you're looking for a way to generate conversation and dialogue, those folks have a lot of knowledge that they could bring to a conversation. And so we just continued the momentum out of that about 3 years ago and have been meeting monthly around these food security issues. And it's keep coming back, so that's good. And so one of the initial ideas was a good food box program, just sort of because it's what everybody does. You know, it was kind of, initially that was one of the things on the list that seemed like it would be an easy thing to do, but we realized that, well, maybe that doesn't make sense for us, so we really sort of slowed it down and looked at what are the interests, what are the needs, and spent about a year meeting and understanding what everybody was doing in the different communities and what the questions were. And then after a year, we realized, okay, yes, that is what we want to do, but we took our time to get to that choice. So there had been conversations for about 10 years with other groups within the First Nations communities individually, within the churches, within a broader community food network that we had started as well, saying, okay, maybe this is a good idea, but to get the resources together, the volunteer capacity, the organization, the logistics, it just hadn't been able to come together to bring a good food box program to Manitoulin. And so what we finally realized when we got this group together was that if we start collaborating with Sudbury, which is a larger urban center that already has a program running, rather than trying to start ourselves, that maybe we start that way for our pilot, and then we see how we can develop it ourselves after. So that's another strategy. If you're a smaller community and you live within reach of a larger community, a way to start. So that's where we're at now. Sudbury is packing the boxes for us, organizing the volunteers there, and we have 80 boxes per month out of Sudbury's 150 to 200 that they do that are being delivered to Manitoulin, already packed and ready to go. So that's the stage we're at now. We started in May, working that way. And so from the Child Poverty Task Force, people that were already at the table, we just opened it up to any of those agencies who wanted to participate in the program, and we realized that to start as an agency-based program, even though that's not the ideal of the Good Food Box, is that it's open to anyone, but we knew we didn't have the logistical coordinating capacity to take $100,007 checks from everybody in the community, so we said, okay, we'll just start for this pilot. People will order through a health center or through the food bank or through an agency that already exists, and that makes it easier at this pilot stage to get going. And 7 agencies said yes. And then I started as the coordinator, but we also have a point person in each of those communities or agencies that is handling it for their own community. So it's a shared process of partnership there. And transportation is really one of the key issues, and so we have found volunteer drivers to bring the food boxes once a month to drive the 2 hours each way to Sudbury, organizing through churches and Lions clubs and community volunteers to do that. And then the community point person in each of the 7 communities arranges the transportation from one spot on Manitoulin to their community. And then there's a transportation from the central location in that town to the homes. And sometimes that's done by a coordinator, and other times it's a collaboration between families themselves. So it's a long journey. We have a church that's donating the space for the distribution and drop-off in Little Current, which is at the northeast corner of the island, so that's the closest point from Sudbury, and then everything goes out from there. And then, so the drivers come up to an hour and a half each way just to Little Current to pick up and take back to their communities. And then there are volunteers in each community that facilitate the distribution once it gets back to the community. Yeah, so we have about 80 boxes per month right now, and the reason why we started at that number is because we thought that's what we can manageably actually transport from Sudbury. So that's 2 vans packed full of boxes, and we just thought we'll start there and go from there. But we already have had a lot of interest. We know that it could be double that tomorrow if we were to put it out there, but right now we have 80 boxes per month. And some of the communities, it goes to the same family every month. And in other communities, it's working through Ontario Works, the disabilities program, the diabetes programs, different wellness programs, so that in May, it goes to these 15 families, and in June, it goes to a different 15 families in that same community. So they're sort of rotating it around so that the impacts, are spread out over more community members. It varies from community to community how they've decided to do that. And we've definitely we did an initial baseline survey in terms of people's eating habits, and then we've tried to do an interim survey just recently, and from what we've gotten back so far, there's absolutely appreciation and need and good response to the project, especially for kids and for seniors. That the population on Manitoulin is much higher than proportionate in terms of seniors, and so that's the other thing, that the small boxes that have a smaller number of food have gone very much to seniors in addition to kids. So the volunteer transportation has definitely been one of the challenges. So our plan was to have a pilot phase for 6 months that works through this project with Sudbury, and then during that time we're now working to see how can we base it on Manitoulin so that we don't have to do this transportational logistics. We haven't found funding yet for a coordinator position, and that's what we need to have before we can actually base it on Manitoulin. But again, the transportation is really one of the keys, which still will be, even if we base it on Manitoulin, unless we find more volunteers to provide transportation within Manitoulin itself. It's just an ongoing challenge. So I think there are we have an aging at home van. I don't know if other communities have that, but to facilitate seniors to stay in their homes longer, and that's one option for transportation. And also the DSAB, the District Social Services Board, has a couple of vans that they use for transportation for Ontario Works clients, and so they've offered at times that we can use that as well. But so we're looking at that transportation and how we can do that distances. And in terms of the payments, so right now about half of the families that are receiving the boxes are paying for the boxes themselves. They pay the health center. The health center does a bulk payment, and then the families make their payments to the staff at the health center or the community agency. The other half, that agency or community service is actually paying for the boxes, and the communities just decided within their internal process which they wanted to do. And the agencies that are paying, I think it just is getting the project going, and people are able to evaluate and experience who otherwise might not have. But there's a question as to whether that can be maintained long term, and how do we look at that funding long term for it to be sustainable. In terms of coordination, it'd be interesting for others that already have projects to know how that coordination is happening. Often it seems to be a staff person from an agency that just that's part of their job description. And we had about 15 people around the table from various agencies and groups, and everyone said, that's part of why it hadn't happened so far, is there wasn't anybody that could take that on in addition to their additional work. And so it's taken years to find a way to make it happen. So what we're doing now, Nourish Health Center initially put in some support because they're working with all 7 First Nations, and they knew that it would benefit all of the communities that they're working with. But we got a Spark grant 2 years ago, I guess, just for the initial conversations and the initial momentum. But that's for the advocacy and not for the ongoing program costs. So what we've done now is each of the communities that's participating has just put in $200 for at least a small stipend to cover it for a year. so that we actually can have the coordinator that took over after I initially started it was working, she knew she'd be working on a volunteer basis to start, but that we would be looking for funding as we went along. And so we have this stipend that will just be a small honorarium basically for a year. But again, we still need to look at what are the sustainable ways to do that. So like I said, we're looking to see how we can base the program on Manitoulin so that we can serve more people and have less transportation. We have 2 local grocers that have agreed that they want to provide us the wholesale cost of food once a month. They're happy to do that. But the cost is going to be higher. Their wholesale price that they get, because we're more remote, is higher than the wholesale prices that Sudbury is getting in the larger urban area. And because the amount that we'd be purchasing is slightly less, the volume is less, so the costs are higher. So we're looking right now into those details in terms of the pros and cons of that. And we would either have to find more money, ask more money, or raise the price, or provide less food per month. So we're looking at those. Working with local farmers, we already have started. So we just started in May. This is our first, summer and fall season. Our goal this year was to have October box be all local food. We thought, okay, that's a time of year that we can think about doing that. So we talked with the farmers in May and said, this is what we want to work towards. They said, okay, we'll keep that on the back of our minds. But with the cold spring and then all the rain in the fall and frost came early and all these things, and so we really, we had a little bit of garlic and a little bit of lettuce, and that was all that we could bring together. We have 4 farmers markets on the island and a good number of local farmers, but everybody's sort of at that subsistence level at this point. So we're looking, as we take it forward for next year and beyond, what are the ways to do that? And that's one of the things I'd like to talk more with you guys about, because the costs then are higher than the industrial food, but the quality is higher and it's supporting the local economy and it's supporting the farmers, and so how do we do that? So that's a question. The Kids Can Grow program is a school-based project that I'm working with, where we're planting seedlings and starting school gardens in schools, and then the kids are selling at the farmers market. So it's kind of a full circle program, and so part of that harvest will also be going towards the Good Food Box, a portion of that, and then a community members asked, can we start a grow a row program that will support the Good Food Box, so that backyard gardeners would contribute food as well. So that will be happening next year for sure. Well, right, in theory, I guess, for sure, as sure as it can be. So there is so much that goes into this Good Food Box coordination, and really it's when you have your 3 categories, it's an emergency, hopefully temporary situation, right? That we hope it will be not something that people will need on an ongoing basis. And so what are the other community food security aspects that we can look at? So we are doing gleaning. We just started that this year as well, because there are so many fruit trees on the island, and so we had 4 different farms that we went to this year. We had issues with quality of the apples, things that I would be happy to eat, but that we weren't able to actually use for the Good Food Box because of concerns about quality of food. So looking at cooking workshops to use some of that could be cooked if it can't be eaten straight, but then even there were some that we said, no, we can't use that at all. So there's a lot of time and effort that goes into that gleaning, and then how much comes out of it, that's more volunteer coordination and another whole project, but it's a piece of it. And then backyard gardens and school gardens. We have 3 school gardens that have started over various years, one in conjunction with the food bank, and 2 others in conjunction with this Kids Can Grow program, that the school garden has been the next step. And so those are other things that we'll be looking at how that can integrate in the future.
Yeah, thank you. Perfect. Heather, thank you so much. So I think we'll just do a very open concept to throw questions. I'm sure you guys are good with that. You're okay with that? Answer all the questions. So hands up.
And certainly if you have the answers.
Yeah, for sure. The stuff that people want to share to add to the information, by all means. Maybe I'll just say one more thing. Yeah, so you spoke about your food mapping. We put together a community food security directory that has all those resources, the community kitchens, the local farmers markets, farms, nutrition programs, and it's online at Angelyn Health Center's website. I forgot my handouts, but Angelyn Health Center.
this is available. So if you're looking for a model of doing that, and then also healthy eating guidelines. That was another Spark grant that we're using in the community for schools, arenas, restaurants.
And we brought a couple of resources about our Nourish program and then also our Food in Peterborough website and Nourish, so help yourselves as well if you're interested.
Great.
Yes, I just have a question. Would your presentation be available online or this?
So all the presentations, as far as I know, unless the presenters have said no, but they're all gonna be on the HC Link website, yeah, after. We just didn't do it before, just like, obviously, weren't seen before, but everything will be up on the website, and you're actually gonna be sent a link after the conference. Yeah.
Do you guys all see the local food fund as being potentially supportive to your project?
If you didn't have to have 50% cash to be matched by the Ontario Local Food Fund, it would be easier. But it's a 50% cost shared program, so you have to have 50% to apply. So it's a little more challenging, and certainly, we've talked about we can dream, right? And there certainly are things like, we have a really strong food box program, and so there is income from that and income from things, but it is certainly a barrier. And it can't be, if you look at the details, it can't be matched by other provincial funds.
I was gonna say, yeah.
So
Yeah.
Trillium, Green Belt, Red, lots, so there are some barriers with that.
Yeah.
How much is a food box for your group? How much is it a month for?
Sorry, $17 for the large box and $8 for the small box.
And they got it weekly?
Monthly.
Sorry,
Monthly.
18 for, okay.
Monthly.
Yeah, and
Oh, sorry.
We also have a food box program called Just Food, and it's twice a month. So we have a staple box and we have a fresh produce box. So fresh produce box, the large is $20 and the small full price, but it's also, you can have a subsidy and we don't ask people pay what they can. So the subsidy is $10 and the small is $12 full price or $6.
Can you guys put that in the back of your presentation? So that we've got that that would be helpful.
If you go actually on the
On your website,
Nourish,
there?
you will
Okay,
see
great.
Your website is amazing.
Yeah, it's very.
It's totally inspiring.
Thank you.
And we're certainly we're excited about some potential new models with Just Food as well. And I don't think we're officially allowed to say, but through the health unit as a lead with student nutrition programs in Peterborough City and County, we're just about to enter a contract with the Greenbelt Fund around their broader public sector, because it's an easy way. Our health unit has direct link with our 46 student nutrition programs, and so we've got a dream about a school Just Food Box program that would look at healthy, affordable, local food into our breakfast program. So we're just at the very beginning stages of that, but it's a perfect opportunity to look at getting local food easily distributed and healthy food easily distributed into school breakfast programs that are based on community volunteers who don't have time to be shopping specials every single week, but then also building capacity for the Just Food program as well.
And so we work with a lot of local farmers. It's interesting when we do an evaluation, a lot of people say, that's the only way I can access local food, which was part of the reason why we wanted to do this Nourish coupon, so that we started to create other opportunities for people to access local food. So that's, and then the other piece that we've done with the Taste of Nourish is do cooking out of the box workshop. So to increase the impact of participating in the food box program. And we don't automatically see that as it's open to anyone. So we don't see that as just for people living on low income. We really see it as another, just like CSAs, and another way to participate in the food economy, but from an alternative approach.
In terms of the local food, did you?
You will get your question.
Oh, sorry.
No, go ahead. I can look at it.
Because for us, it definitely feels like the price purchase from the local farmers is higher than the bulk purchasing from the grocery stores or the warehouses. So how were you able to fund that? Is this a question of scale, or do you have extra funding? Or?
So for us, it was really important to work with local farmers and to pay farmers a fair price. So we end up doing a lot of fundraising work in order to be able to do that.
So that's external fundraising, and that's part of the staff, the coordinator position that's paid in other ways.
Correct. And then because we are out of the YWCA, so there are also agency-involved fundraising activities that we're going on.
Thanks. No, I find this, all of the initiatives that are going on just fascinating. It's just amazing. And to see the difference too between rural and remote. Like that's even more interesting, you know, when you really think about it. Yeah, there's that whole transportation coordination piece that you're all talking about. I just wonder, like, have you what are the other options around transportation? Because that's really key, right, to get that there. Are you able to partner with any businesses? I'm thinking like Purolators all over the place. FedEx, I don't know, like those kinds of partners that might be interested or vested in offering up some time.
Yeah, I'll speak to this. So what we researched for that, because Manitoulin Transport is based on Manitoulin. Trucks going by. But it's a question of the scheduling, because it's fresh perishable food. In the middle of winter, it's -30, and they couldn't offer anything that didn't have to sit overnight. And so they would have been willing to give us a discounted rate, but they weren't able to. It doesn't work logistically because they don't get there that quickly. Purolator is an option, but that would have been a full cost. We weren't able to get a discounted rate for that. What we have been doing is working with Eat Local Sudbury, which is an amazing model for a regional food co-op. They've been very collaborative with us, and they have a van. So my farm and 4 other farms on Manitoulin are providing products to Eat Local Sudbury. So they do a delivery for the farm products, and so they're now helping us with the delivery for the Good Food Box from Sudbury to Manitoulin. But they've had to rent a U-Haul trailer in order to do that, but they've agreed for the time being that they will do that just to, again, it's sort of to keep it going another 6 months, say, while we look for other options. But again, it's the logistics of the perishable food that is a higher cost, more delicate product to be able to transport. It's possible, but it takes more protective, it's delicate.
And how long would it take to get up to sort of Hudson Bay?
For Hudson Bay, they are able to do it in 2 days the way that because they set it up themselves. The specific that Joseph is amazing in terms of he's so mellow and just so persistent that he makes these things happen. But yeah, so it's 2 days for it to get there. Normally through normal channels, it's like a week. Yeah. I forgot my other handout, but there's a video. If you go to the Sustain Ontario website, and they have a Growing Good Food Ideas link, and they have all these videos, and there are 3 from those northern remote communities, and I can't think of what it's called, but it's about the Fort Albany Farmers Market, and there's a video about what it takes to get that food from Food Share in Toronto up to Fort Albany, and it talks about the impacts because they've set up a market there based on that food coming in. That's their farmers market, is this food coming from Food Share that's such higher quality than what they can get in a northern store, and much lower price. It's $24 for a 10-pound bag of potatoes from the northern store. That's their daily food access versus their Good Food Box is 9 items and it's $80, which is way more than we would think was sustainable, but for them, it's half the price of what that food would cost at their store. So again, every context is totally different, but it's looking at what we can do. Yeah.
So I did have questions about some transportation stuff, but you might have answered it. But then I also, as you're talking about rural and remote, and because you're working with Aboriginal populations, how much are you doing, or how much is being done, or that you may or may not be aware of revitalizing traditional food systems?
Yeah, on Manitoulin, there's a lot happening. We haven't linked that directly with the Good Food Box, but there's much more teaching of food skills, especially in Wikwemikong, which is the largest First Nation on Manitoulin. they have quite a bit of funding and quite a bit of momentum going right now around the fishing, hunting, gathering, and those foods. And within NAN, with the northern communities, that's very much a part of what they're doing. And one of the other videos that's on the Sustain link is about the, again, I don't remember the fancy name for the video, but it's about the fishing and forestry foods that are coming in. So there's a lot happening in the Far North and also on Manitoulin. And one of the things that I did a couple years ago was coordinate a cross-cultural local foods festival. So we had the local farmers and what you would sort of traditionally think of, but then we had the traditional foods and speakers and stories and practices. And so we had a day-long festival and symposium that brought the two together. And that was from an OAFE grant, Ontario Agri-Food Education, there we go. And that was, again, hugely well responded to in the community, and we should do another one soon.
When we get all that time on our hands.
Exactly.
Yeah. Well, I hate to be, go ahead. It's quick.
Yeah, just touching quickly on the participation and partnerships between natives and non-natives. I mean, this morning we heard about the French minority, and the interaction with the English majority. But in your case, how did that work?
It works.
Could you expand on that?
It works really well, and that's at the beginning I was saying that often on Manitoulin things are quite segregated, but with these food and family and food issues, there's been amazing collaboration that's been happening with these projects.
How did you manage to reach out beyond the native community?
There's a really strong local food movement. So I'm an organic farmer, so I have been involved from the farming perspective, but then also from the food security perspective. So I guess maybe I'm one of the links between the two because I had worked in both communities, but the interest is just there. So it was just, making phone calls and talking to people and saying, do you want to come? And then they came back. So I don't know. And just finding the people who are interested in the issues in each of the communities and finding one person, and then it spreads from there.
And in Peterborough County, we have two First Nations, Hiawatha and Curve Lake, and I think our Board of Health is still a bit of an anomaly that we have a representative from each of our First Nations communities on our Board of Health. And so that opens the door for more partnerships and working with the community, with the First Nation health centers, and then that translates into partnerships like with the YW and the Just Food program. But I think it comes down to that food brings people together, and we've been really fortunate that we've had funding to support a basic food skills program called Come Cook With Us, which has been quite popular in our First Nations communities to bring people together around basic food skills and then transition into collective kitchens and that sort of thing. So we have a Lovesick Lake First Nations, which is for off-reserve First Nation, and so they've really, the young mums and have really embraced that and actually have collective kitchens happening on their own now, which is fabulous. So I think it's that power of food.
Yeah, I think it is.
And the health issues too, maybe, the urgency of the health issues that people they know that they want to do something, and this is something that feels tangible, that they can actually see something happening. And we have yet to see what the long-term impacts of that are going to be, but in the short term, it's it's a step that people actually feel like they can.
I think it's those partners around health. Like we have a Southern Ontario Aboriginal Diabetes program that has really has done a lot of focus in the last maybe 2 years in Peterborough City and County. So again, we've been able as an organization to connect with someone who's already connected with our First Nations community. So it just makes it easier where we can come in and support and learn as well.
Perfect. So I don't want you guys to be late for lunch. The last of the group. So we want to thank our presenters. So, well, thank you, Carolyn and Heather. Thank you so much. If you wouldn't mind, we're going to do the evaluation again with the flip charts. At the back, the stickers are just stuck where the markers usually go.